The 2020 NFL season was something like we have never seen before, and I'm joined now by Drs. Kinderknecht and Dr. Rodeo from Hospital for Special Surgery. And gentlemen, I want to talk about how you guys started this season and how these COVID protocols came to be. Can you shed some light on how these were formulated?
I think we got a lot of guidance from the NFL, actually. I think the NFL, frankly, did a fabulous job in really guiding us all through this, starting with leadership. Alan Sills, the chief medical officer, and assembling really a panel of experts, infectious disease specialists, cardiologists. There's tremendous communication from the NFL to all of our team medical staffs, and our job was to kind of translate that information then to our teams.
And I mean, you mentioned the evolving process. Dr. Kinderknecht, can you speak on this perhaps of how you guys adjusted as things changed so frequently?
So a lot of it was just learning some patterns, and we had a database that really was never achieved before. So in terms of spread and testing and the whole protocols.
Absolutely. And of the changes that were made this season, do you see any that are going to move forward past this COVID-19 pandemic and become part of a norm of how an NFL season operates?
To think that we're going to go back to normal anytime soon would be a misnomer. So I think there are several things that we're doing now that we're going to incorporate. But I think we've learned, like a lot of people have, is you can do a lot of things virtually like we're doing today that are quite effective. They're tools that we can use to be more efficient. So I think that's probably the biggest thing.
I think we need to keep our eye on the ball. We need to continue to be data-driven. And as we learn more about the vaccine, I think we need to not become complacent anytime soon. So, yeah, there's great optimism. I think there's a lot of unanswered questions in the environment still.
Is there anything that you look back on in the way that things were implemented going into this 2020 season that you say, you know what, knowing now, if we knew then what we know now, we would do this differently?
If you had asked me in August, could we get through the season as unscathed as we got through, I would say there was 0% chance. It all came down to the players and the coaching staff really listening to what we had to say and complying and not complaining.
One thing I had, kind of a neat lesson or example, was how a collaborative effort working together, you can accomplish a lot. You can say it on a lot of levels. I mean, just development of a vaccine nationally, what a huge collaborative effort. But within the NFL, a highly collaborative effort amongst physicians, the scientists, the policymakers, the NFL personnel, and putting together these protocols and helping us implement the protocols. And then at the team level, the team working together, the staff, the coaches, the players, the trainers, us. I mean, everybody kind of was working together, and that's I think why it worked, quite honestly. I mean, it was everybody kind of collaborating and toward a common goal.
And also, it seemed the contact tracing was pretty successful. When a positive test would come through, it was very quick to get the appropriate people quarantined, correct?
Yeah, I was impressed with I was going to mention the contact tracing. I mean, it's another lesson learned. The NFL really put a lot of resources into doing this, financial and human resources, but the ability to, in particular, to isolate or identify close contacts, individuals who even if you tested negative, you're out for 5 days, and it turned out that those individuals identified as a close contact often did in fact become positive. So that really mitigated a lot of problems. The devil's in the details. I mean, that's what made, I think, the difference in a lot of ways.
You guys both touched on just the participation, the adhering to the protocols that were set in place, and the teamwork that it took for the NFL to get through this whole season. What would you say to folks at home who are just navigating the COVID-19 pandemic in their day-to-day lives? Basic
principles that we've all learned: PPE, social distancing, hygiene, face masks. These basic principles work.
Wearing the face mask work. We have evidence of that that they really do work. So if people question that, we can tell them undeniably they work.
Thank you both for taking the time and for the work that you do to keep this New York Giants football team healthy on and off the field. Dr. Kinderknecht, Dr. Rodeo from Hospital for Special Surgery, so grateful for the insight.
Thank you. Thanks for having us.
Thanks.